Hey guys, I hope you all are doing well today. This video is kind of weird for me to be doing, but a lot of you guys have asked me for this, so I thought I would go ahead and do it because I'm here to do whatever you guys want. Like whatever it is that you guys want me to do or talk about, let me know, and if I have some sort of knowledge about it, I'll be more than happy to do it for you guys. But today's video is about LASIK eye surgery, and the reason people have been asking me to talk about it is because I just got it done recently. Today is like January 13th and I got it done on December 22nd, so it's been less than a month. And so I guess you guys wanted to know like what the procedure was about, like what it did for me, like how I feel now, like how was it when the surgery was going on, that kind of thing. So let me start off by saying that it's really important to find a doctor that you really believe in, that you think is good. I went to a doctor that I was recommended to after I found out that a few of my friends had gotten it done from him, and a family doctor that we know had also gone to him. So obviously the doctor that I went to is very renowned, he's well known, and he does a good job. So I felt really comfortable from the get-go. And for me, LASIK was something that I like kind of had to get done. I've been working so much recently and coming back so late at night that it became really hard for me to drive around with my contacts and be comfortable. I've been wearing contacts for the last 7 or 8 years, and I used to put them in from like 6 o'clock in the morning when I used to wake up for school and take them off late at night and be just fine. But in the last few months it's been really hard for me. Like I had to like take them off at 5 or 6 p.m. because my eyes couldn't breathe with contacts. It hurt, it burned, it just wasn't comfortable. And being a girl, I guess, like I didn't want to wear glasses, you know, like most girls wouldn't want to wear glasses all day. So I talked to my parents and stuff, and we just decided that it was important to just go ahead and get LASIK. So I went in for an evaluation with this doctor. Most companies are going to give you a free evaluation, and it's really important to get a few done, you know, so you can find out which doctor you like the best. They're going to talk to you about your different options for LASIK, how you want to build your surgery, different prices, you know, they'll give you like a really in-depth eye exam to find out if you have any other problems. That was really important to me because my right eye always gave me more trouble. I have astigmatism in my right eye, and my cylinders are like differently shaped and stuff, so I kind of have more problems in my right eye. So I was concerned about that to begin with, but when I went to this doctor and I did my evaluation, we found out that I had another problem as well. I have asemblia, which basically means that the nerve from my eye doesn't connect to my brain and doesn't transmit messages. So due to that, my left eye kind of took on like a much bigger burden and does more work on a daily basis. So regardless of anything, my right eye will never be 20/20, regardless of LASIK or if I wear contacts or glasses or anything. So basically, your doctor will tell you about, you know, your personal issues, like what your eyes can do, what they cannot, and because of the in-depth exam that they give you, he can really find out if there's anything underlying that might reduce, you know, the success of your surgery. So it's really important to go to somebody good who will really care and look in depth to find out if there's anything wrong. So with that being said, you know, he told me straight away that the #1 thing is that it's surgery, it's not magic. So you're only a good patient if you know that, one, you know, you're not going to recover the next day, you're not going to feel amazing, your eyes are going to be a little bit blurry, and it's not as though you can wake up and feel like you're 100% fine and your eyes are just perfect overnight. Like that's not how it works. So I understood that, but at the same time, everybody that I know who has gotten LASIK has always said that, oh, you know, the next day I was perfect. So I thought that would happen to me, but I woke up the next day and I felt like something was wrong with me because my eyes hadn't really come together to work together as well as I expected it to. They were a lot weaker than I wanted it to be, and therefore I just felt like something was wrong. I was really nervous. I got really upset thinking that like something's wrong with me, like everybody had such a great experience, what happened to me? So I called the doctor, and he said, you know, it's fine, it's normal, don't worry about it, your eyes will settle down after a few days. And I would say after about a week is when I felt really comfortable with my eyes. Every doctor tells you that the next day you're good to go, you can drive, you can do this, you can do that, but I would definitely suggest, if you're going to get it, to wait, to put away at least a week to recover. I chose a more expensive surgery just because I wanted it to be intralaser, which basically means that it was very non-invasive. Everything was done through a laser, so nothing was directly touching my eyes. They have 2 different ways of doing surgery generally. One is with a blade, so it's a blade that goes in and cuts your corneal flap open. Then you'll move to a second machine, and that machine will send in a laser to correct your number. So I chose a laser, so even the first part was done with the laser, and the second part was done with the laser as well. Due to that, it's more expensive because it's a much newer technology. But I'm terrified of doctors. I don't like doctors in hospitals, so for me to go with the more expensive technique was just a no-brainer, because I probably would have said no if I had to go with the blade technique. But that doesn't mean that there's anything wrong with it. Like, they both give you the same results. It just depends on, you know, what you can afford and what you're comfortable with. If you're not scared, then why would you pay a few $1,000s more to get the same results? It's completely up to you. But so there are two machines. The first machine is going to cut your corneal flap, and regardless of if you do it with a blade or a laser, it's still doing that. So what they do is that you're going to lie down, they'll tie up your hair and stuff, and they'll take like a metal piece and put it over your eye. It stretches out your eyelids, one up, one down, and really kind of pushes your eyeball out a little bit, so that like whatever they're doing is much easier to do, because they don't have to like work around your skin and things like that. So they push a metal piece around your eyeball, and that actually really hurt. Like, it was a lot of pressure on the eye, and after he kept pushing down, and basically, I'm not trying to scare you guys, but it felt like a fist was being jammed into your eye, like farther and farther in. And I've never been punched or anything like that, thank God. So I don't know if that's exactly what it feels like, but that's what it felt like to me. And I was having a heart attack. Like the doctor was talking to me, he was asking me if I was okay. And I was just like, oh my God, like this doesn't feel comfortable. It feels like, you know, bad and this and that. And he was like, don't worry, but in a few seconds you're about to go all black. Like, you won't be able to see anything. That was really weird, because everything did go black, and I couldn't tell if I was awake or if I was sleeping, or if everything was okay. Like, I didn't know what was happening. I felt like I was like passing out or something. I don't know. It was a really weird sensation. But then he put me out of the machine, and he did the corneal flap or whatever. At that time, it's just more pressure on your eye. So I wouldn't say it's pain. It's more like pressure on your eye, but no one generally puts that kind of pressure on your eye. So it's something that you guys have never felt before. And due to that, I was worried, but it literally took 20 seconds, and then he did the second eye. So it's a really fast procedure. This first part takes between 15 to 90 seconds. So at the most, you know, it can take up to 90 seconds, but it's well worth it. Like, it gets done so fast, and then you wonder, like, why you were, you know, freaking out so much. The second machine, for me, I didn't feel anything. I didn't see anything. But my dad was watching the surgery from outside. There was like a glass window, and he said that like the second part was really scary to him. So I don't exactly know what they did. All I know is that they made me look up at this revolving thing. It had a bunch of different lights, and the doctor told me to focus on the red light. That was apparently the laser, and that was following my eyeball. So again, like, they put something to hold your eye, but this one doesn't put any pressure in for some reason. You don't feel anything, and it just feels, I mean, you're just looking at this bright light, and that's doing something. So you can move your eyes around. Of course, don't test the system by like rotating your eye and doing whatever you want, but the point is that your eye is gonna think that it's still blinking, but it can't, because your lids are like pulled apart. But it's hard to like look at the same thing for such a long period of time. So my eyeball obviously was moving a little bit here and there, but the machine was able to catch that and, you know, do the surgery. For this second machine, the doctor really wasn't doing much. He had already done some scans on my eyes and put that into the system, and the machine was doing it by itself. So he was just more like holding my head and just making sure that I was okay. And then this was the weird part. After it was done, he put in some eye drops, again with that thing holding my eye in so that I couldn't really see what was happening. And then all I remember seeing was like, it was like a little mop or something that he was putting across my eye, and I know it was directly on my eye, so he was touching my eye, but I couldn't feel anything, because at this point your eyes are numbed. Your eyes, they numb you before you go into surgery, so you don't feel, you know, as much. I guess the only thing that you really feel is the pressure. So it's not a scary surgery, but it is a surgery, and it's gonna take a few days to recover. So don't go in there thinking that you'll be back to work the next day and everything will be fine, because for me, like, I did it during winter break, knowing that I didn't have much to do at that time. I'm out of college, but I do work as a makeup artist, you know this. So I did it at a specific time that I knew I didn't have anything to do for about a week to 10 days, so I had that time to recover. And though I was really annoyed sitting at home and not doing much, it was the best decision of my life, because when I got done with the surgery, I felt fine. Like, I could see better, but not 100% obviously. So I was sitting in the doctor's chair and everything was fine. I didn't even feel like I'd gone through surgery, but 10 minutes into talking to the doctor, like my eye started hurting so badly. Like it was like a lot of pain. And so the doctor was like, okay, just go home, rest. After 2 hours, you can start putting in your eye drops. There were 3 eye drops to put in at 2-hour increments. So I went home, and when I was in the car, literally like I wanted to break down and cry because my eyes hurt so badly. And the thing is, he didn't tell me this would happen because he said that most patients don't have a reaction like this. He said about 80% of the patients feel completely normal and go about their normal life, but then there's 20% of patients who go through the pain that I did. So he didn't warn me about this thinking that it wouldn't happen to me, but it did, and it did hurt. So don't think that, you know, everything will be fine. I'm not trying to scare you guys, but I just want you guys to know the good and the bad, like all parts of it, just so you're aware of what could happen to you and you don't freak out. But I went home, I went to sleep after 2 hours, I put in my eye drops and I was fine. The thing is that your eyes get extremely dry, so you have to put in lots of lubricating drops and stuff that they'll walk you through. But for about 9 days to 11 days, you have a ton of eye drops and little medicines to put into your eyes. So you have to be very, like, you have to be responsible enough to do that. Like, no one's gonna follow you around and tell you what to do. It's just, you had surgery and you have to take care of yourself after that. You can also get scarring on your eyes, but it's something that I didn't get. Most patients don't get it, but there's a few who might. And that's just like little tiny red dots in your eyes that are not very noticeable, but they're there. So that's another thing that you shouldn't freak out about if that happens to you, but that didn't happen to me. For about 4 days, I didn't drive or anything like that because I didn't think my vision was good enough to do so. Also, the other thing is that after LASIK, your eyes get very light sensitive, so you have to be really careful about wearing sunglasses when you go outside for 3 months. You shouldn't have any contact with direct sunlight. So it's just all about like being responsible and making sure that you take care of yourself because, again, like I've said this so many times, that it's surgery, you have to recover. Just because you don't see any evidence of what's happened to you doesn't mean that it isn't serious, doesn't mean that it's just easy and you can do what you want. But you'll be completely able to function, you'll be able to do whatever you want, but I didn't get on the computer, look at my phone, anything like that for 4 days, and doctors tell you that you can, but I didn't really see the need to like strain my eyes and do more than I'm supposed to. Because my mom got LASIK about 10 years ago, and her number came back within a year. And she thinks it's because of the fact that, one, she didn't wear sunglasses because her doctor didn't warn her not to. To wear sunglasses. And 2, because she watched a lot of movies and kind of sat at home on the computer and did whatever she wanted to right after she got it and didn't exactly put in time towards resting. So I don't know if that's exactly why hers didn't work. I'm sure there were other issues as well, but once I heard that, like, I had to be very sure that I was doing the right thing, and it would be really sad if I put myself through this only to see my number come back so soon. Night driving might be an issue for about a week to 2 weeks because your eyes are so sensitive to light that at night, especially on the highway and stuff, when you're only seeing a bunch of headlights and taillights, then it can get kind of annoying for your eyes. And then also around lights, like lamps and candles and Christmas lights or whatever, you'll see like a halo. Like, meaning that like the light will just like come out of the major focal point of that light, and so that can kind of annoy you. That got to me a lot for the first 2 weeks, especially candles. That was like the worst thing for me. Since I got this around Christmas and stuff, we had a lot of decorations and candles and stuff up around our house, and that really got to me because my eyes were extremely light sensitive. So just be careful about what you're doing. It's not a terrible surgery. It's quite easy compared to other surgeries. In the fact that you can walk in and walk out yourself, you're not on bed rest or anything of that kind. It's been exactly 3 weeks actually today. Yeah, today's Wednesday, so it's been exactly 3 weeks since my surgery, and to me, I feel like I can see perfectly, but I went into my doctor, like, after you get your surgery, you have to go in for a bunch of follow-up visits, so I've been to 3, and he told me that my vision has not reached 20/20 yet. It's very close, but it's not 20/20 yet, so if I already feel like I can see perfectly right now, then I'm really happy with the results because I could not wear contacts any longer. It was really bothering me. So I'm happy with my results. I think it's amazing. But the other thing is you have to keep in mind, like, another reason LASIK might not work for you is that if you're really young and you decide to go in and get it, and if your eyes happen to change like they normally would, then LASIK, of course, is going to change with it. For example, if you're like 15 years old and you wear glasses, but you're always by the computer and you're learning, you're studying, so you have to read books all the time and things like that, then the chance of your number changing and becoming higher is very much greater than people whose numbers have stabilized. So I would suggest waiting until you're 21 for sure before you get LASIK, because it's going to be such a waste of money if you don't. Most people who've gotten it done at a very young age, it hasn't worked, in the sense that it works for a year or two, then your number comes right back, but you want it to work for as long as it can. Of course, it's not a lifetime procedure, because most people, you know, when you turn 40 or 50, you tend to get reading glasses and things like that, so that might change as time goes on, but your number should never come back to where it is right now or where it was before you got surgery. So in that sense, it's really good, but I definitely would say wait until you're of the age to make sure that your number has stabilized. And once you go in for your evaluation, your doctor will tell you, you know, if your number has stabilized or not. But keep in mind, a lot of doctors want your money, so he might say that you're a great candidate for it, but think about it yourself. You might be dying to get it, but if you haven't, like, if you're aware that for the past 3 years you've been going to the eye doctor, your number has steadily been increasing, then your number hasn't stabilized. The only way you know that it has is if you've gone to the doctor and you've come back knowing that your number hasn't changed because you haven't had to get a new prescription for your glasses or contacts. So just make sure you're a good candidate. Ask them all the questions you want to know. It's really, really, really important. It's surgery and you need to know exactly what you're getting yourself into. But besides that, I'm really, really happy with my results. I think it's amazing. It's completely made me so much more confident, because I feel like I can see much more. I'm more willing to notice things and look around. I don't know, like I wake up in the morning and I can see perfectly, and it's amazing. I hope this is helpful to you guys. If you have more questions, feel free to comment below or private message me. I'm not any expert in this at all, but I'm just trying to give you guys my feedback on what I thought, you know, LASIK did for me and what I went through during the procedure. So I'll talk to you soon. Bye!